Back to the legislature now, where nurses and now several hospital systems are concerned as lawmakers work to find a compromise on the Keeping Nurses at the Bedside Act. Today, Essentia leaders spoke out following a change to the bill to exempt Mayo Clinic from the proposed rules. Our Laura Lee joins us in studio with why they say the bill does little to solve the nursing crisis.
As you can imagine, there is pushback from Minnesota hospitals after lawmakers are considering exempting Mayo Clinic from the nurse bill. Hospital administration telling us today the proposals are simply bad for Minnesota. Hospitals say that the bill does little to remedy the nurse staffing problem. Instead, they say the focus should be on supply, hiring more nurses. Essentia Health, along with other state hospitals, are expressing concerns about the legislation currently under debate at the Capitol. One of the big ones, a potential 15% reduction in hospital capacity, which would threaten access to about 70,000 Minnesotans. Dr. Bill Heegard says mandates never work, especially in healthcare, when he says it should be dynamic. Essentia Health urging lawmakers to now heed the warnings from healthcare systems across the state, including the largest healthcare system, Mayo Clinic.
As evidenced by all the CEOs signed a letter through the Minnesota Hospital Association. That is unique in that they all signed this saying that this will hurt, not help, patient care and access. And that's especially true in rural Minnesota.
Essentia Health says they disagree about the exception for Mayo Clinic from the proposed rules. The hospital says it is working on retention, listening to its own nursing staff to find solutions in their hospitals. Essentia is also suggesting a solution would be to use a state's surplus to increase the workforce. The Minnesota Hospital Association says there are more than 5,000 open RN positions. Dr. Heegard says the focus should be to work together to invest and build that nursing pipeline. Back to you.
Thank you, Laura. The Minnesota Nurses Association is responding to Essentia's position on the bill. And while they agree with Essentia that Mayo Clinic should not be exempt from this bill, they disagree with Essentia's claim that their bill will prevent Minnesotans from getting care.
What we're really doing is making sure that the staff is available to provide the care. You know, if President Hager wants to throw on some scrubs and join me at the bedside and provide that care, I'd love to help. But I think scaring Minnesotans isn't the way to do it.
Members testified in a conference committee hearing today. After it initially passed as part of the House and Senate omnibus bills, the Keeping Nurses at the Bedside Act will now move forward as a standalone measure. Wednesday, Essentia Health CEO Dr. David Herman testified in Washington in front of a congressional committee. He discussed the current landscape of rural health care and the importance of partnering with patients to provide the right care at the right time. Dr. Herman said Essentia's value-based care is especially crucial in rural communities where patients often have needs related to food insecurity, transportation, or financial difficulties.
Stratifying patients by their clinical and social needs rather than by payer is the most effective and most equitable. Our approach creates a model of care delivery that is as standard as possible and unique as necessary to meet the needs of our patients and their communities.
Dr. Herman said lawmakers can support their work by aligning financial incentives with value-based care and protecting critical safety net programs that help rural hospitals.